Good afternoon, everyone.
Hello.
Hi.
Radha ma'am.
Hello, ma'am. Kalpana, ma'am.
Yes, hello. I couldn't join. I actually got something wrong with the laptop, so I have to join over the mobile.
No problem. Dr. Pallavi, ma'am, once you will give green signal, we will start our session. Okay?
Okay.
Just give us green signal.
Ma'am, please start. Hello. Anuradha ma'am.
Yes, ma'am.
Yeah, ma'am.
Good afternoon and welcome all of you on behalf of Women Pediatrician Forum in this unique program, which also happens to be our 22nd program of this calendar today. With this program having two objectives. With due permission from our chairperson, Dr. Sangita Lodha ma'am, we are heading towards today's program. Dr. Sangita ma'am, may I start?
Yeah, just I want to welcome all of them. Dear respected President-elect Dr. Neela Mohan Madam and her team, accept our warm congratulations on your victory and best wishes for your success as you prepare to take up the responsibilities and challenges as President-elect 2025. As you embark upon your new responsibilities, I wish to assure you that members of WPF will be continued with same passion for work, whether it is academics or other fronts. I look forward to working with you not only to develop a closer relationship between Central IP and WPF, but also to concert our efforts in the cause of welfare for the community work and empowerment of all members. Now, I welcome all of you. And Dr. Anuradha, you can just proceed.
Yes, ma'am. In the first part of today's program, we will felicitate and honor our newly elected women members in CIAP elections. This time, we feel proud and honored to declare that highest democratic post of president has been won by our own Dr. Neela Mohan ma'am, who was working very hard since last 1 year to make this dream come true. We are witnessing this day after a long hiatus of quarter of a century, that is 26 years. To support her, we'll also have the post of Vice President South Zone, Dr. Preeti Galgali ma'am, and Joint Secretary Liaison, Dr. Ruchira Gupta ma'am, who is already working in this post since last 1 year. We feel immensely happy to declare that all our women members who fought for any post in CIAP election have won with thumping majority, and either by contesting or unanimously. So a big round of applause for all of them. So we have 7 EP members from various states. I will call them one by one after the opening remarks from our President, Joint Secretary and Vice President ma'am. Second agenda of today's program will be our unique monthly webinar tete-a-tete session, episode 8, in which our guest speaker will be Dr. Smita Mishra ma'am, a renowned pediatric cardiologist. This will be moderated by Dr. Anamika Jain. Now I invite our chairperson, Dr. Sangita Lodha ma'am, to welcome all the dignitaries of and the CIAP WPF election winners. Dr. Sangita ma'am.
I have welcomed all of them. So now I think we will start the session of our welcoming. One by one, we will call all the dignitaries. First, you call Dr. Neela Mohan Madam, and then later on, all the dignitaries.
The one and only one lady, Iron Lady, I must say, Dr. Neela Mohan ma'am, who has CIAP president-elect election, and she will be CIAP president in year 2026. Dr. Neela Mohan ma'am, we would like to listen to your journey of this thumping victory.
Thank you
Dr.
so
Neela
much.
Mohan.
At the outset, I just want to check. Can you hear me, Anuradha?
Yes, ma'am.
Yes, ma'am.
Okay. So at the onset, I would just like to start with congratulating the WPF Forum. Not necessarily for me, but I think in society to support their women colleagues and to motivate them. And I think it is important for all of us to appreciate as well as to let all of us know of our weaknesses and strength. The purpose of this forum is, like we say, always weakening. It was subconsciously made, but the constitution that reads, Sangita will talk about it, it is to empower women and to support and work in the field of child health at large. And I'm truly, truly humbled to be elected to this post of President-elect 2025. And it's been 25 years that a woman came to this position. So I would start by expressing my gratitude to Almighty, to my parents, to family and friends who believed in me. Why did I decide to do this is quite a question I've been asked to. Well, this journey actually taught me a lot. I have people who know me as an academician know that I have actually ended up giving 1,000 talks in almost close to 30 years, 2000. So close to 25 years of my career as a consultant, which would mean an average of 40 talks in a year. 40 weekends, I would be traveling either way. So what did I do different? This time was I did this journey. I spent almost close to 88 days to 90 days of traveling in various states, and it gave me an immensely enriching and I would say a transformative experience. The opportunity to connect deeply to the IAPNs across the country rekindled my old bonds with many and forged new friendships and truly appreciate the strength of our fraternity at large. There are a lot of people who were just interested in serving the community.
Madam, your
Can you
voice is
mute others
going.
so that we can record this, Anuradha? Yeah. So, so there were many colleagues who knew me earlier as an accomplished academician. But I think I'm truly humbled that they could resonate with my vision for the future of pediatrics and to recognize the ability that I could balance the academics with leadership and proven administrative qualities. For those who didn't know me earlier, got an opportunity to know that I had been into various international posts earlier, being as the president of Commonwealth for 4 years. It gave me a truly vision where I was working for a lot of countries at the same time into responsible posts. And the leadership post that has come, what I was 5 years before this was much different. They change your personality, they change the role where you understand it's not about me. I've still seen in this journey that there are think most of the time about themselves. And I think that mentor women out there. So I remained focused on channelizing my positive energy with every interaction that I did. And my campaign was trust me with integrity. I did not commit bribe during this journey to the people who connected with me. There was a genuine desire to contribute to the association, and that was resonating well with the others who believed in me and trusted me and chose me for the National IAP President. I'm so grateful to all of you that I am not here to talk any negative about anyone, but as I said, that it's extremely important to channelize your energies into positivity. I was not rude, cunning politician with those those strategies. No, my strategies were very simple, very new, very novel, touching the core of those people who really wanted a change. A change, not I meant as a woman, a change in an academician with a good leadership position who can utilize. So I would always say, choose me and vote for me if you think I'm capable and not just because I'm a woman. And that's what I always want to say. Choose a woman if she's capable and not just because she's a woman, because that's not what my message would be. So though my students came to work, thank you so much, but then I'm going to give you back to me. The pediatric gastro fraternity, for whom I've been working more than 8 years into various positions, the IAP chapter secretary, president IAP chapter secretary, president is SPGAN. So there have been a lot of years besides the ED. So a decade more years where I served in the administrative role, so I can understand that it was justified. But this journey taught me a lot more. This journey taught me that the people whom I was really relying on would come back as friends. Some of them didn't turn home. They were people who were opportunistic and were looking at themselves, but then God sends angels. Because the vision, my sincerity and commitment was very genuine. I met people whom I call angels who came forward. I did not ask anybody to post flyers or anything. They came forward and did. And we know in the Women Forum who they are. There have been many in the Women Forum who came forward to support. But there is a lot more to be done because majority of the time they were quiet. It's one did not have the guts to come out and say that we so they have such instances. Understand this point. You need to help others without your self-interest, and that is when you do. God will give it back to you. All of us. It means it includes me too. We need to understand this, and that's what I always talk about. So this journey was not just about an election. It was about celebration of the collective strength, the strength of all of us to our IAP family. We respect our colleagues. We love working. The bond in us is our desire to serve children at large. And the bond of WPF is to talk to our friends, to motivate them, strengthen them, and to rekindle and our own initiative, own this thing, and try to help as much as we can to all of the people around us. I'm very deeply grateful to everyone who stood by me. I'm grateful without any commitments from my side. Thank you so much, you all stood for me. And I embrace this honor with a renewed commitment to serve and contribute to our shared mission of advancing pediatric care. And I promise to all of you all, when your intentions are good, I'm here to hear you. And thank you once again. And I look forward to WPF for always standing to my side, and I will do my best that I can for the WPF society. Thank you.
Thank you, and rightly said, Neelam ma'am. Your journey was truly celebration of our collective strength. Thank you so much for being with us. Now I invite Dr. Ruchira.
So I always said in my flyers, I said the victory is not me, it is ours. So all those women out there, who for 25 years wanted to be in that, I give my crown and this victory to all of you. Imagine that you are the president and tell what are the changes you would want to do. Write to me, connect to me, and say, if I were you, I would have done this. And let's see what is the unanimous thoughts of all of you, and I'll try my best to.
Yes, ma'am. We'll make a collective plan in next 1 month and let you know soon our points. Now I invite Dr. Ruchira Gupta, ma'am, who is Joint Secretary license since last 1 year. Dr. Ruchira, she will be continuing her tenure in this year as well. Dr. Ruchira, ma'am.
Thank you very much, Anuradha. At the outset, I would like to thank Dr. Sangita, Dr. Elizabeth ma'am, Dr. Madhuraturi ma'am, Dr. Sanadya, and all the respected women present on this forum to give me this opportunity to share this platform with you all. Dr. Anuradha said,
yes,
that Ruchira ma'am, आप अपना एक journey बताना, isn't it?
Yeah.
So, dear friends, I want to say, I'm so grateful to be here today, sharing my journey with such an incredible group of women. Your energy and presence means so much to me. Like many of you, I have also faced many challenges that tested my courage and patience, but also moments that shaped me into the person I am today. Dear friends, I grew up in a world where expectations were high and resources felt limited, and I knew I had to carve my own path with determination and creativity. And only the challenges which come in the path, they actually shape you, as Dr. Neelam was telling, that definitely each challenge make you resilient. And that resilience only is a double-edged strength for all of us. Being women, we are God-gifted by the nature that even during the tough times, we come out with resilience, with bounding success. Sometimes we are being underestimated, especially as a role of a leader or entrepreneur. So as a women, I thought that we had to navigate constantly to make our path very clear. I remember an incident when Pedicon had to be organized at UP, and the Pedicon bid had to be sent from UP state. And you all understand that UP, it was told that UP is the the thought process used to be like that. I won't say like that because now the things are changing, but a little bit of sometimes the orthodox thinking, sometimes different kind of thought processes, but with different challenges, different things. And I was really, there were a lot of times when it was discovered, it was said that can a women be there at such a position? Can a women be a chief organizing secretary of such a mega event, prestigious event of IAP? And at that very point of time, I had thought that I will work here. I want to make this event an exceptional event, exemplary one, with the passion, with compassion. And then I had a tagline there that we are going to provide the best possible academic event under one roof with international standards and with amazing Indian hospitality, and tried to work on that. And so this was a couple of things, these challenges every woman keep on facing. And I had also gone through certain challenges like that. But it's not like that everyone is there to be against you. There are few people who are there who understand, who realize potential in you, trust in you, and that's how you move forward. Also, dear friends, I feel women have a unique ability to balance the strength and empathy, and that's our superpower. And that's what helps us in breaking barriers. And this is how we are going to lift each other up. I will not take much longer because I know there are so many people who have to share their stories and challenges and their journeys. But definitely now Dr. Neelam is a woman is going to lead IAP. So I feel that today I want to challenge each one of you to take a step forward towards your dream, no matter how small it is. What the world needs is your brilliance, your creativity, and your voice. And whatever we do with innovation, with creativity. And once again, I thank you all for letting me share my journey with you. Remember, we rise by lifting others and togetherness, and there is nothing we can't achieve. Dr. Neelam is one of the examples. Thank you very much, dear
Thank you,
Anuradha, for
Dr.
giving me
Ruchira.
this opportunity.
Thank you, Ruchira ma'am. Certainly, challenges makes us more resilient. Now I invite Dr. Preeti Galgali ma'am, who has won the election for the post of Vice President, South Zone. Dr. Preeti Galgali ma'am, for her words of wisdom.
Thank you so much, Dr. Anuradha, Dr. Sangita, and the entire WPF team. It's a pleasure to be here. Let me first congratulate the terrific 10. As I see the poster that you have posted on all the groups, starting with Neelam, Ruchira, Sushma, Srilekha, Kalpana, Nehal, Baljender, Deepa, and Rashna. So we are the 10 people who are going to be representing WPF, and we are going to be your voices in the IAP Executive Board. So feel free to reach out to any of us. We are all there for you. I thank each one of you for supporting me, for voting for me, for encouraging me, and for guiding me. I know there are so many of you who guided me at very, very crucial times when I thought all was lost. And thank you very much from the bottom of my heart. You know, I'm not going to name each one of you, and you know very well who are those people. So thank you once again. They say the harder the obstacles are, the sweeter the victory is. And that's exactly my condition right now. I must make a candid confession here. My fight was not against anybody. It was standing up for myself. The fight was against psychophancy, misogyny, and nepotism. And through winning this election, I would like to put a very strong point forward. I hope that none of you have to face what I face day in and out in my 6 months of campaigning. And if you do, you know where you have to reach out to. And I have the full faith and belief that we can counter all this together and be a winner, not only in the IAP elections, but shine in all other aspects of life. And to my younger colleagues, I would like to say, please go ahead and work with dedication, with sincerity, with enthusiasm, because IAP is watching. IAPians are watching. The world is watching. And let me tell you, hard work and academics, community work, all that pays in the long run. So in the next 1 year, my aim is going to be aiming for the stars, yes, indeed, but also aiming to reach out to the hearts of each one of you to team up together for academic excellence, for community well-being, for youth engagement, and in fact, make IAP a better place to live in and work for. Thank you once again for all your support.
Truly said, harder the obstacles, sweeter is the victory. Now I invite our all executive members for a brief thing. First of all, Dr. Kalpana Datta ma'am.
Yeah, I and Dr. Anuradha, I just want to make a request because only 1 minute. Just we want to hear from you because the next session is immediately after this session, na? So give chance to all of them, but be little bit
Concise.
rather than okay, yeah.
Dr. Kalpana ma'am, are you there? Dr. Baljinder Kaur ma'am.
Kalpana ma'am first.
Can you hear me?
Yes,
Yeah.
yes.
Okay. So, good afternoon to everyone, and thank you, Dr. Anuradha and Dr. Sangita. They are so active, dynamic ladies, and I really feel honored and privileged to be here. And a huge congratulations to Dr. Neelam. And I already said 7 days prior to result, I asked Neelam, you asked, buy saris, you are going to win. So it was really very joyous moment to have a lady a president in 2026 after, and I want to congratulate Dr. Sangita for your enormous work on the vaccine. So human papilloma vaccine, she has done a wonderful landmark. I don't think anyone can achieve that landmark he has acted. And a few minutes, because I am having admission day, I'm in a hurry, I'll leave that thing. So just I'll say, because the last 3 consecutive years, I'm having this, I have won this EB executive board member from West Bengal. The first 2 years, there was a huge contest and I won with the highest vote. So I feel honored and privileged, and this time there's no election. So without unelected, because there's no election, there's no contestant against me. So it is easy, smooth. I won. So there's no credit for this time because there's no competitors. The last 2, I have got the highest vote because of the love and all those things, academics from my state. And I'd like to devote my time. I'll try to be with you if we'll get the time. And with, of course, we'll talk to we would like to do the collaboration with the veterinary firm with the IIP as much as possible from my side. And thank you for giving me the opportunity. Thank you all. And please excuse me, I'll leave. My admission day is going on. Just I finished my OPD. Okay. Thank you. Thank you all.
Thank you, ma'am. Thank you, ma'am. Now I invite Dr. Baljinder Kaur, ma'am. She's already in another webinar. Are you free, ma'am? I think she might be stuck. Dr. Srilekha Joshi, ma'am. Dr. Srilekha, ma'am, are you there? Dr. Nehal Patel, ma'am.
Yeah. Hi. Hi, everyone. And my huge and sweet hi to everyone in the WPF, the Women's Pediatric Forum, and thought by all the leaders, and a work which is done from the heart and very hard work by all of you, but guided by mainly Sangita Lodha madam and many other. But now the journey is taken by many others like us. So when I first contested, it was like from Gujarat, there was nobody who contested since so many years. After the there was no election after that, and a woman could took part in it. Nobody was interested. So when I showed my interest, everybody was surprised. But yes, with the our academics, with my hard work and whatever we say, with the guidance of seniors, I was elected with the majority of the vote, highest vote for the first time. Then for the second time again, people were like, you take a break and go again next year. So then at that time, actually, my son was also in the 12th. So I was also a little bit shaky that should I go ahead or not. But then again, took some strength and contested again. The thing was, my health was not at all good at the time of elections, so couldn't reach to each and everybody. But still, the work speaks, and the work which was done in 1 year, that came out, and I got not the highest, but yes, I got elected. This year, as it was consecutive 3rd year, people were not in favor of me. Those who are like telling me not to go for the 3rd EB. But then I said, let me give myself a chance. There are so many things which I yet to finish in CIAP. I committed to it and I yet to finish. So again, contested with my heart, connected to each and everybody by calling each and everybody in Gujarat, and again came with the highest vote. So once you have decided, nobody can stop you, because we have the people who guide us, and we need to be courageous. The love is always there. Just get it. Thank you.
Thank you, ma'am, for your hat-trick victory. The Dr. Deepa Firke, ma'am. Dr. Deepa Firke, ma'am.
Yeah. Yes. Thank you, Dr. Sangita Lodha, ma'am, Dr. Anuradha, ma'am, for this honor today. I won't take much of time. It's really a proud moment for us that after 25 years, we have got a lady president. And therefore, this is the start of a new beginning. And I think it's, as Preeti ma'am said, it's the dedicated work that speaks for us. So all those women who are sitting there, watching there, you all deserve to be here. So I just say that just believe in yourself, keep on doing the dedicated work, and you all will be here, and we all together can do this. Thank you so much.
Thank you, ma'am. Dr. Sushma Ketani, ma'am. Dr. Sushma, ma'am, are you there? Dr. Rashna Das, ma'am. Dr. Baljinder Kaur, ma'am, have you joined, ma'am? Dr. Srilekha Joshi, ma'am. So none of them are here. So here we have met most of our talented 10. Preeti Galgali ma'am told it is terrible 10. I will like to say it is talented 10.
No,
Now
terrific, terrific 10.
Okay. Terrific.
Terrific.
Joke of the
So
day.
for us, it is talented 10.
Terrific.
Now
So
I
I would just,
as teach.
Anuradha, before
Yes,
you
ma'am.
started, just half a second I'll take, though I didn't want to name, but everybody was there to support. But I think my heart cries out to two people, Madhuratri and Asha Benappa, who kept guiding me and stood like rocks with me. And thank you, Sangita and Anuradha, for always showering your love and affection and doing it.
Yeah,
So
Neelam,
I
I'm just
think
going to
these
say
two
one thing.
ladies they are not human. They are something above humans. Madhu
I
and
just
Asha.
want to
Radha,
say,
if suppose anybody joins later, we will just take them also on the board after the session of Dr. Smita Mishra. So I think we should go for Smita Mishra's session of tete-a-tete. Okay?
just
then
Now
one
for
line,
the next
all
part
of
of
you.
this.
just one line, Neelam. Good evening, everyone.
Yeah.
Everyone was supporting, but we were vocal, openly. That is the
Exactly.
Yes. Yeah.
So you came out as rock and guided.
thing. People also.
Thank
Good
you
evening, ma'am.
because
That you are
what
supporting.
you need at that time is even this.
Yeah.
Thank you
That
so
is the
much.
thing. Nice.
Now we are heading towards the second part of today's session. For this session, we are having a brilliant speaker, Dr. Smita Mishra ma'am, who is pediatric cardiologist at Delhi, and moderator will be Dr. Anamika Jain. Let me introduce Dr. Anamika Jain. She is MD Pediatrics from Banaras Hindu University and did her SIship in pediatric cardiology from AIIMS New Delhi, along with FNB in pediatric cardiology from NH Bangalore. And she is currently working as pediatric fetal cardiology unit and doing intervention since 2010 in Jaipur. She has various presentations in reputed conferences and published various articles in index journals. With this, I hand over to Dr. Anamika Jain for further conduction of session.
Thank you very much, Dr. Anuradha. I hope you can hear my voice.
Hello, Dr. Anamika. Good afternoon.
Yeah, hi, good afternoon. It's my pleasure to be here present with so many important dignitaries of the nation, and congratulations to all the winners of this election. I would straight away start off with the session. दिल के दाग, I'll start with the poem. दिल के जख्म जब गीत में ढलते हैं तो कायनात रोती है, जलजले से उठते हैं. तो मैं हंसता हूँ एक हाथ सीने में रख, जिसमें कितने सुराख रहते हैं. बंद गलियां भी हैं मेरे दिल में और दरवाजे भी. संगीत है मेरे दिल में भी, मरमर उसे लोग कहते हैं. This poem is written by none other than our present speaker, today's speaker, Dr. Smita Mishra. He is a talented, compassionate pediatric cardiologist. And I would like to introduce her as she's a HOD of the Pediatric Cardiology Department in Manipal Hospital, Dwarka, Delhi. She has been past president of IAP Cardiology Chapter. She has been part of several bodies who have written consensus for a pediatric cardiology on drugs, formulary, timing of interventions, and related to diagnosis of CSG in India. She conceptualized Spandan program, which was adopted by Atal Bal Hriday Upchar Yojana. She also runs a charitable trust for children with heart disease. She is a fighter with indomitable spirit, and she is dedicated to establish guidelines and policy making regarding disability criteria in cardiac patients, because these patients, when they are treated, then they have a life later on, then they face several challenges which need to be addressed. And present disability criteria does not include congenital heart disease patients with disabilities in the disability criteria, so they have to struggle a lot. So I will like to hand over with this and welcome Dr. Smita Mishra to the present her talk on this.
Thank you so much, Dr. Anamika. Wonderful introduction, and I'm so proud of you. You are doing a lot of work in Jaipur, and you are icon in yourself in the pediatric cardiology. Thank you, Dr. Sangita, Dr. Anuradha, Dr. Madhu, and Dr. Neelam has left. I mean, I should actually congratulate her, and I'm so proud of her. So I'm just giving this to IT person, so they set up. Yeah.
अच्छा कोई बात वो ओपीडी में भी लिखना है
वो करना है टोटल मतलब जैसे फुल स्क्रीन लेके और फिर आपने किया था ना फुल स्क्रीन कर
Pallavi ji will display the slides, ma'am, if needed.
Are you
They have already tested. They have already tested. Ma'am is sharing.
I am sharing my screen.
Yes,
Can
yes,
I?
ma'am.
Yeah.
Yes, ma'am.
Just 2 minutes extra. Yeah.
Ma'am, make it full screen first.
Yes, yes.
On the
What you
chat.
said.
Yeah.
That is what we are trying to do. Yeah.
Yes, yes.
Wait.
First, make sure that your presentation is full screen. After that, click on the share button. Can you see a share button? Yes.
Can you see?
Yes, ma'am. Just click on the from beginning button.
Now you can see?
No, we cannot see your full screen, but slides are visible.
So, पहले हमारे
अभी आपने किया था ना
कमल मेरे साथ में था एक
तो फिर उसको आना चाहिए
सर आई टेल यू आप करते जाइए आप स्टॉप शेयरिंग कर दीजिए पहले
इसको
शेयर कर दिया है आप एक काम करिए पहले जूम की विंडो मिनिमाइज करिए फिर उसके बाद आपका जो प्रेजेंटेशन है मैडम का उसको आप स्लाइड शो मोड पे लेके जाइए
मैंने अभी पीपीटी ओपन कर लिया मैम की
हाँ पीपीटी के बाद उसको आप फुल स्क्रीन या फिर स्लाइड शो मोड पे ले जाइए
मैंने फुल स्क्रीन वाले पे
स्क्रीन दिख रहा है आपको पीपीटी आपका फुल स्क्रीन दिख रहा है क्या आपको
हाँ दिख रहा है मुझे
हाँ अभी आप जूम का विंडो ओपन करिए
अभी मैंने फुल स्क्रीन कर दिया है लेकिन फिर उसके बाद शेयरिंग कैसे करेंगे ये तो
हाँ मैं बताती हूँ सर आपको आप जूम का विंडो ओपन करिए
भेजा नहीं है
अभी इसको मिनिमाइज कर दीजिए और जूम का विंडो लीजिए
नहीं उन्होंने नहीं किया था कमल ने किया था
जूम का विंडो आपको दिख रहा है क्या जूम का विंडो
ये तो पूरी बड़ी स्क्रीन पे आ गया है
विंडो डी पे करिए विंडो और डी ये बटन प्रेस करिए
विंडो और डी
आइकॉन और डी
हाँ
हो गया आपको अभी जूम का लिंक दिख रहा है
अब मैं डायरेक्ट उसको पीपीटी को मैंने पहले ही वो कर रखा है बड़ा कर रखा है तो अब शेयर कर दूं ना सीधा
हाँ शेयर कर दीजिए और वो विंडो से सिलेक्ट करिए आप हो जाएगा जी शेयर पे क्लिक किया सर आपने
हाँ कर दिया अभी
हाँ फिर उसके बाद फुल स्क्रीन परफेक्ट हो गया है नहीं जूम आउट मत करिए
ठीक है अभी?
Perfect. Yes.
Yeah.
So I'm so sorry for the delay, and thank you for my IT person also. Otherwise, I wouldn't have been sharing it, and also Shifali. So thank you so much, Dr. Sangita, giving me this chance. And actually, I'm kind of working for a cause, and I really want that many people must know, and they should keep on talking about all these issues. So thank you, Dr. Sangita, Anuradha, Dr. Elizabeth, and Dr. Madhu is so, most of the time I'm interacting with her. So it's a wonderful interaction. And Dr. Anamika, you are really great and for all good words. So basically I am I just want to change the way we look at the congenital heart disease. So most of the time, what we think of congenital heart disease about the mortality, we don't think about the quality of life, and we will not see the disability involved and the kind of disability load we are going to get in because of the congenital heart disease. Sometimes untreated congenital heart disease surviving long, and sometimes treated congenital heart disease but is still surviving long. So that is the thing, and there we don't have a second some backup facilities in our society, in our government programs. So that is what this poem was all about. Last line I would like to actually recite that मैं जानता हूँ हाथ बढ़े हैं जमाने के मुझे बचाने के खातिर, कुछ और तेज कदमों से चलें तो दिलों में रफूगरी हो, दिल के सुराख बंद हों और दरवाजे खुल चलें, निजात हो बेबसी से और सपनों की जादूगरी भी हो. So we know CSD incidents, and I'm not going to actually talk about this. But we must know that congenital heart disease may not always have a hemodynamic significance. So we can actually divide this in group ABC. This is from one of my publications. So non-progressive hemodynamically insignificant congenital heart disease, group 2 hemodynamically significant to begin with, needing the intervention like large VSD, ASD, and single ventricle, other complex diseases. And the third is the progressive CSD, where initially you are thinking that everything is fine, but then subsequently you may land up into a serious disease like the bicuspid aortic valve or aortic stenosis. So we also know it may be acyanotic and cyanotic. Simple way of knowing is the pulse oximeter. We should not avoid use of pulse oximeter, because so many times we can miss, because we all know that cyanosis can be seen only at the cutoff of 85%, even less when anemia is there. So what could be a management plan for CSD? It may be a cath intervention or surgical intervention. And what are the method to correct a congenital heart disease? This may be a anatomical total correction. Sometimes you are correcting only physiology but not the anatomy, as you do in the single ventricular repair, Fontan repair, or sometimes palliation you give like the BT shunt, like the PA bending. So this is a complete physiological correction is the Fontan or TCPC. But what I want to draw your attention towards it, because whenever you have a critical congenital heart disease, and most of the time we keep on talking about the critical congenital heart disease, TGA, pulmonary atresia, obstructive TAPVC, 80 to 90% mortality within a year if not treated. But if they survive, what will happen? So, there is a chance of survival of 10 to 30% even for the critical congenital heart disease. Initially, there is a chance of losing life, but subsequently, there might be something underlying, like a presence of PDA. So, you keep on getting patient like hypoplastic left heart syndrome. I have met at the 18-year, 20-year, because of the collateral development, because of the persistence of PDA, and with very, very poor quality of life. So what is the poor quality of life? That is defined as disability. So here we need to look at whole thing from a new aspects and new, we have to see the new vision. We should not look at whole thing just like a mortality perspective. So this is really good to know that even 10 or almost 10% of mortality can be reduced in the neonatal NICU for the full term neonate if we are properly doing functional echo and recognizing the recognizing the congenital heart disease very early. So we need to look at many part when we are dealing with the congenital heart disease, and those are like a nutritional concern, infection. There are many syndromal attachment. Many congenital heart disease will come with the package of the syndrome. So these are the things which we need to see, and we are not thinking about it. Then what I want to convey that congenital heart disease management is not a single point cure. This may, you are from the fetal life up to the old age, you may always have some problem or other association of comorbidities which are non-cardiac or even the cardiac comorbidities. There is part of it because of our little understanding, like a smaller thing, play. Should a child with congenital heart disease should play or not? Should dance or not? So those are the smaller issues which we are not thinking about, and we are not guiding a patient. Then subsequently, I would like to draw your attention about the inability of a cardiac surgeon or cardiologist to complete cure a child or to prevent any other consequence. Like in this particular child, I was very happy when I started a program, Spandan, got a free operation for this child for the right ventricular outflow obstruction. And at the 10 years of age, because all these schemes will come only for a one surgery. So after 10, around 10 years of age, when this child met me, then it was really very sad story because it was all left ventricular hypertrophy. Why? Because there was a subaortic membrane. This is a complication. Whenever you get a hemodynamic, complex hemodynamics, you will get these kind of complications. Similarly, a TOF repair, we were very happy initial days, TOF has been repaired. But such a high number of people will come back to you that now Dr. Anamika will agree with me that we are telling everyone that there is a chance to go for a pulmonary valve implantation in some point of time. So these are the misunderstanding about the congenital heart disease. Parents think something, they actually spend whole, they sell out their assets thinking that okay, child now is absolutely fine, but there are so many problems associated with. So overall survival has improved, but as you can say that there may be, if not is redo surgery, but then there could be many intervention in within, like in these charts you can see this is overall survival for the post-op patient. Then this is sudden cardiac death. Okay, it is quite protected, but if you see here the re-intervention for the various complications, they are definitely there. So and then curious case of bicuspid valve. They are also 2% of total population may be affected, and 2% of them may have a definite intervention in the future. Then pulmonary hypertension. You may have a very low normal PA pressure to begin with, but then subsequently you will have hypertension in the second, third decade, and even the cyanotic heart disease may present with the pulmonary hypertension when they are associated with the large blood flow, and also a cyanotic heart disease, we all know. So heart failure in adult with CST is very important thing. Not only they come with the package of lifestyle diseases, infective endocarditis, diabetes mellitus, metabolic syndrome, coronary artery disease, and and besides they also may have a intractable arrhythmias, need for pacemaker, ventricular dysfunction, and multiple hospitalization, So infective endocarditis is such an important thing. It may actually eat away the valve, and a totally balanced bicuspid aortic valve may come up with a very serious complication. So adult congenital heart disease with heart failure now being considered as a pandemic, because there are so many patients of the surviving. We are very happy that we are operating so many, and that was the reason why when I actually wrote to PCSI telling them that if you are thinking that 1000 patients should be operated in 1000 center in across India, looking at the incidence of the congenital heart disease, because we think that around 60,000 children are born every year in India needing some kind of intervention. So in that case, you will have more than 2 lakhs patient who will be, when 26, 28 years, they will have multiple problem, no health insurance, no life insurance, nothing to support them. So these are the things which we need to think about, and we should actually have to have a system of classifying them where they can have a kind of disability status. But there is a paradox. A patient having a small PDA may be treated as a uh, cardiac patient, a tiny PDA. I have got a 6 feet tall person, tiny PDA, was rejected he was a chemical engineer, he was rejected from job. So that patient came to me and I could not even pass a catheter to that PDA. So it was just a way to, because you have a CSD, unless you are corrected, you cannot come into this. Another chemical engineer went for surgery at 26 years of age. Since then, till then, he was happy person. And once he was treated, he was fired from the job. He was a congenital heart disease patient. So these are the things. They are global. WHO has done a wonderful job. So these global studies have given us lot of information how these congenital heart disease or Eisenmenger syndrome or single ventricle ponton surgeries subsequently end up in this temperature chart in the red zone. So they are really high risk and they have nothing to support, I must say. There is definitely difference in the incidence of congestive heart failure in these groups, and the people who are having a higher economic developed countries and high economic strata, they are actually not so badly affected. So your economic status makes you like in this particular case, see the better outcome CSD in high SDI group. You can see here they are all in blue. So this is very important that if VSD you are operating at proper age, like the 6 month, if it is required earlier even, then this patient has high chance of very, very good life. But if patient is having residual pulmonary arterial hypertension and older age group, then you really have lot of disability even after. So there is a global increase in the CSD patient. There, and CSD patient needs multi-specialty approach. Now you all are treating with the congenital heart disease. I am sure that because every one of you dealing with these kind of patients, because number of the patient, they are actually reaching to adolescent age group or the adulthood. So definitely they must have passed through your center. So you know how difficult it is, because you need to have so many you need to have so many specialty to be involved. And now if it is a private setup, you should understand how much money is required just for the consultation in so many specialties. So pediatric inpatient hospital resource used for the congenital heart defect, they have seen, it is an American study, and you can see that total hospitalization patients, only 4% had congenital heart disease, but the resource utilization was huge. So this is very important. And then it is not only the child who is suffering, it is the parents who are suffering. So there are many stories. Dr. Anamika might be having, you all must be having, and I also have, because I worked with them at the grassroots level. I went for the camps. I continued to to and fro system, because I had a Spandan program in Madhya Pradesh, Riva. Started in 2003 looking at the assignment rise, high income group patient, HIV. So that is a thing, like identification early is very important. But once the children they have a scar, 14-year-old will say, how can I get rid of this scar? So there are many psychological issues. So we need to actually know these patients are prone for psychological issues, depression, suicidal tendencies, behavioral disorder. Above all, they can land into drug. So this is very important. I got my one of the patient operated. Patient was the around 18 years of age. He needed some money. I actually gave some money, and then once I went for a camp in the area where this it was Agra. So father took me to somewhere, some wealthy people to meet, that we can start a charitable program there. And there he said that, सी मैडम जी, मैंने इसके लिए तो घर भी भेज दिया, ये भी कर दिया, अब देखो ये क्या कर रहा है, ये तो शराब पीता पड़ा रहता है. Now tell me, what should be the option? I said, see, money is not an important thing. You keep that. I don't need that. But the thing is, you will never tell this child that you have sold your assets. You cannot oblige him, because he had a certain kind of problem. That never mean that we should actually make him responsible for his problem. So the mindset, we need to know mindset. We should not be happy that we have operated a patient and we are very happy. See, this is Appu George.
If we are going for a job or anything, the main thing is, because of the CHD, we should not be eliminated from that job if we are qualified and everything. Second thing is, for the surgeries and everything, everyone is getting insurance, but why CSD is eliminated from it? CSD is in 90%, it's as per 1 out of 100 is CSD ratio, and in that itself, 8 out of 10 or 100 is completely means complex CSDs, and for them they need around.
So I stop here for the sake of time. But you are meeting a great warrior who had single ventricular heart. He was not operated up to 18 years of age. He needed a BT shunt, because that time it was not. He is now 37 years old. So he was, that time it was not actually so prevalent. Even Amrita Institute of Medical Sciences was not there in Kochi. Then it came, and the same time he started having a lot of issues. Then BT shunt was done, then Glenn was done, and he went in. Then Fontan was done, and he stayed in the ECMO for 3-4 days. So this is the big warrior he is. Not only that, he actually now pursuing a career, and he is working for himself. And he got me this laptop, which I am presenting my this thing, that my old laptop was not working well. I was in PCSI conference, so he helped me getting this particular laptop on which I am presenting today's case. So he is a warrior. In another video, he actually told his heart out. He said that I cannot go for a marriage. Nobody is going to accept me. This is the kind of problem they are going to deal with. So what IRDA guidelines says in 2019, there were court case, depending based on the court case, there was a guideline which said that the congenital heart disease and the inheritable disorder should not be excluded. There should be a product for them. So you must have heard many interviews from the insurance companies, CEOs, that now we are going to produce a good product for these things. How can they, unless they have some planning? They never had a planning. Why? Because availability of second level ultrasound, a patient congenital heart disease or any congenital disease has been identified, then why some people will go for the insurance only then when this disease is identified? So you will not call it insurance. It will exactly be a charity. So we need to know okay, what could be a way out to give a fetal insurance. So that was the question in my mind. And we actually in 2022, along with PCSI, then PCSI President Dr. Rajesh Sharma, who is a city-based surgeon, we went to Mr. Karak, Finance Minister, state, and many of you must be aware of him because he's a pediatric surgeon. He was very happy what proposal we gave. And what was this proposal? This proposal said you should give a product in the first trimester itself when the diagnosis cannot be made. If diagnosis is made, then termination is available. So if first trimester insurance, some product is there, then it's a win-win situation because unpredictability is there, 1 to 2% chance of having a defect. And even if you are having a defect, then second trimester ultrasound will tell it that if it is a complex defect, in that case, the termination can be done. So that is how you will handle the disability burden. And if not, you can have a proper insurance product which can help you in treating that child. So this is what we have given. He was very happy. He said he will do it. And then this was the later in 2022 was circulated and it was given to us also. I got a personal mail also for this that it will be done. We had Dr. Rajesh Sharma and me. We met IRDA people. We sat there, 2 presentations. We tried to emphasize that they can do it, but actually not accept that Star Health has one product where they ask for second level ultrasound. If second level ultrasound is normal, then they will give fetal insurance. What is the advantage of this? There is an advantage because like PDA, like ASD, like posterior urethral valve, the multiple thing is still there which may need treatment after the birth. And not only that, I think there should be a role when you are giving an insurance in the antenatal period. It should be not only that newborn will be insured from day one, renewal should also be applied that year after year as you do for any other health insurance. It should be done for them also. So now coming to the questionable functional capacity and perception of disability, but if measured, there is no disability like in a post-op ASD, post-op VSD, or maybe simple PFO, LSVC, mitral valve prolapse, bicuspid aortic valve. Still, these, because of detection of murmur or so many things, they will be actually called as disabled by the few people, not by all. Then have a limited capacity to perform, but no official tool to measure it or label it. We have done it. This is the proposed method for the evaluation and categorization of functional capacity of children, adolescents, and adults with the cardiac diseases to bring them in existing social justice system by creating the cardiac disability criteria. This is a PubMed article, and that is we have created the criteria according to existing rule. So no or mild disability, moderate or severe, and this is very important for the marriage prospect, for the sports prospect, for the job prospects. There's so many things, and for the health insurance where they at a like a blanket negation can be given for these kids who are operated for ASD, BSD. They should be given the health insurance because they are normal so far. So can CSD be prevented? This is very important thing. One should always think about prevention, public health approach to improve the outcome for the congenital heart disease across the lifespan. And it says that according to one estimate, optimized preconception glycemic control can prevent 2,670 CSDs annually. Rubella vaccination, folic acid supplementation, avoid smoking, alcohol, teratogenic drugs, and the fetal echo or fetal ultrasound for the overall congenital defect. So, in summary, The congenital heart disease is an important cause of infant and under 5 mortality. Modern interventional technique give a chance to have a long life. A cure is possible for big chunk of CSD, almost 70%, but financial assistance is required even for the middle class or proceed as procedures are costly. However, at least 1/4 of the post-op cases and the unoperated significant CSDs need hospitalization, early onset of the adult cardiac diseases, arrhythmia, heart failure, rhythm disorder, and may exaggerate financial burden. Unemployability, school failure, growth issues, body image issues are substantial issues. Multi-specialty support is required. Newborn insurance and disability status is required. So I finish over here, and I would like to ask comment from Dr. Anamika. What she thinks, what are her experiences?
Yeah, Dr. Smita, it was a wonderful talk, and really it was a thought-provoking that when we are correcting so many children with heart disease, then their life is prolonged. So as well, their problems are also prolonged. So I had certain things to ask. Like now we have more and more women as part of the people who are holding up the positions in IAP. And so what type of help you have had in the past?
Hello? Hello? So, Dr. Anamika, can everyone hear me so I can answer? Dr. Anamika, yeah, please.
No,
Hello?
we are unable to hear you, Dr. Smita. And welcome, Dr. Swati Bhavi, ma'am.
Oh, hi, Dr. Bhavya, ma'am.
Yeah.
Hello, can you hear me?
Smita, we are unable to hear you.
Just a minute. Okay. Huh? Hello, hello. Connectivity. मेरा वो देना phone देना.
Unmute yourself, Dr. Smita.
I'm unmuted, but I don't know why it is not being heard.
Pallavi, can you look after this problem?
Hello? 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 Hello?
Hello?
Dr. Smita? I think Dr. Anuradha, are you there? Hello, Dr. Anuradha? Hello, Dr. Anuradha?
I would like to add, like, as till the time the Dr. Smita is able to speak up, I would like to add that as children with disability grow, so I think what I find that adolescent child care is little lagging behind in our country. So I think we need more and more pediatrician to get trained and be more oriented in the adolescent care, so that there are certain adolescent issues in and which are exaggerated in CHD patients because the hemodynamics are disturbed. So they can be better taken care of if we have more and more team of pediatricians who are trained in adolescent care.
Hello.
Hello.
Maybe we can increase the programs which are running, training of such things from the IAP.
Hello.
Smita, we can hear you now. We can hear you now.
That's great. So the thing is, and Dr. Neelam has left.
Anyway.
Hello.
Dr. Swati Bhave madam is
can
there
hear
on
me?
board. I request to
Can
hear.
you hear me?
Yes.
Can you hear? Yeah. So what I want to, I am trying to write IAP president, one after another, Dr. Ramesh and everyone, that there should be cooperation between the different bodies who are dealing with the congenital defect, like pediatric surgeons, like the cardiologists, cardiosurgeons. So we have a integrated group where the patient support group should be there, and Foxy, because if you're talking about the fetal insurance, so in that case it should come, Foxy people should be involved with us, and I will request you, Sangeeta, that we should have a combined meeting with them also. And the thing is, one more thing, like for the fetal insurance, we have I will tell you, just talk to Dr. Swati Bhave, then I tell you.
Okay, Dr. Smita, we are going to just plan out for year 2025, and that time you just join us, and then we will put this for all these things in front of Dr. Neera Mohan. So we can plan out in 2025 and can be just acted in 2026. So just please join with us during OBAB meeting of planning of 2025. Okay. And now I request Dr. Swati Bhave, madam, the legendary personality, and so delighted to see you here, madam. And lots of thanks to you for joining us, because this is I can say this is brainchild of your Women Pediatricians Forum, and now has just become a small, not big but a small tree, and we are doing, I think personally, good with all of them. And the result you can see, as Dr. Neelam Mohan, Dr. Priti Galagali, so many ladies pediatricians are there on Central IP. And I think somewhere it is your idea of putting a Women Pediatricians Forum. Uh, I just can't say few words. I want to hear from you. Thank you, ma'am, for joining us.
So thank you, Sangeeta. First of all, Smita, I apologize for not joining in time. This is my afternoon rest time, and it's very difficult for me to keep my eyes open at 3 o'clock.
Ma'am, whenever and wherever, it's all blessings,
Thank you. So when I just got up for a cup of tea, I saw Sangeeta, as usual, affectionately giving me the link on my personal chat. So I asked her, is it too late to join? And she said no, so I'm joined. And it's so wonderful to see all the lovely faces of women I have worked with over years. And I'm so proud this year. And I've just no words to express my happiness. You know, from the year 2020, 20 years after I became president, and Hema took the first bold step of contesting as a woman president of IAP. I have been waiting for my record break, because I was a president sixth into 2020, and the president before me was in 1987, Dr. Aulukita Desai, who unfortunately passed away recently. And then it took 3 years for Hema and 1 more year for Sangeeta. And at last, Neelam Mohan got the crown of the presidentship. And I have simply no words to express my happiness. And all of us know that when a woman leads, it's a different leadership. It's a holistic leadership. And whichever association she leads, things go for better. And under Neelam, I'm really looking forward for a better and a different IEP. Looking at the vice presidents, we have had vice presidents before. We had Rekha Harish, we had Pallavi, I think,
Dr. Sangeeta.
Sangeeta Yadav. But Preeti is a different ball game. And I'm looking forward that Preeti, just as you galvanized the AHA, you galvanized the International Forum, you do something tremendously well along with Neelam. I mean, of course, with next year, Neelam will be there. But I'm looking forward to you doing something really remarkable. And I'm really proud of you. And Preeti has been my student and then a colleague over years. And all the 6 women, 3 of them who have come unopposed to the EB, congratulations to all of them. And the 3 women who fought and came, I think who are the ones who fought and came. One is Firke, who's the other one? 3 women who fought and came.
Nehal Patel, Dr. Nehal Patel.
Nehal Patel. So we have 6 women in this program, and it's really remarkable. And Neelam, it's not only nice to be a good leader, but it's lovely to have a lovely face. And I think that faces of you and Preetam and all these beautiful ladies who are not only beautiful inside, but even beautiful outside, are going to have a different thing when you come on the TV shows, when you come on the banners, when you come on all this, because women power is different. And you all will give those messages in a much better way. And I have no words to thank Sangita, Bafna, Lodha. I always call her Jadu Ki Pidiya. In 2016, Hema put forward the dream of IIP Women's Wing and we founded as a founder chair. And it's been a very long journey. And today now we are an independent body. We are not dependent on anybody, which is, I think, a beautiful thing. And last year, Goa conference, all of us who came, founded, and Sangita, we are looking forward to that bonding again. So again, I'm sorry I don't
I
come to
know
all
we are
the
looking.
webinars. I know I don't come for all the webinars, but hopefully next year when my health issues are more stable, I look to rejoining WPF. I've never been out of it, but I've just taken a long leave. So wonderful girls, all of you. Ruchira, congratulations. You're also on the main stream just now. So all this banner was beautiful. All 7 of you and the crown on Neelam's head. As usual, Sangita has these wonderful ideas. Thank you so much, everybody. I'm so happy I'm here.
Thank you, ma'am.
Thank you so much, Swati, for those kind words. Thank you so much. You've not been there, but there was this Guru Dronacharya and this thing, like I didn't message you once to for any help, but I knew you are there when I need. And all that I used to write to you is, how are you? That's all. And thank you. And that's the way I guess your love, affection, and blessings came, because just that emoji, what you would send, was enough to say you're on the right side.
And Anuradha
Thank
is
you
doing a
so much.
wonderful job as
And
Secretary
it's a
W.
privilege to.
Yeah. Sorry to interrupt. Anuradha, you're doing a wonderful job as the Women Pediatric Forum.
Thank you.
Secretary.
Thank
And
you
the
so
whole,
much,
I'm not
ma'am.
taking all the names in case I forget one. The whole new WPF is doing a fantastic job. And Preeti and Sangita, your We Connect is beautiful, that bulletin.
Thank you.
I do go through it also.
Thank you, madam, for being there. That's all that I can say. For being there always and forever.
Thank you.
Thank you.
Next year, Neelam, कुछ तो भी glorious करो तुम लोग सब मिलके. A different thing, quarter century.
Yes, ma'am.
That's what I was just saying, that पहले तो we should do brainstorming of all the ideas. डालना काटना फिर डालना फिर काटना फिर फाइनल करना. That's fun, where you need to just take it forward, because right now, as a lot of people didn't like it, but at the same time, always make it a point when I meet men to put it across that conference was just everybody wearing their own dress.
We'll make a close committee, ma'am,
So-
and we'll write down the points.
And no I keep talking about that to not to have any concern. So that is what we need to come, taking everybody forward and not upsetting anybody.
I just wanted to say one thing, Smita. You're a born poetess. You write such beautiful poems that touch your heart, and you just connect with everybody. And those birds are so lovely, and you're picking up such lovely and very serious topics like depression and writing on it, and autism and all. It's wonderful. Please keep sharing.
Thank you so much, ma'am. Thank you so
Ma'am,
much.
you
And
have command
your
of
blessings
Hindi and
and
English
personal
both.
message are very encouraging for me. And I can't, I am probably little introvert, and over the period of time, I am getting introverted, but obviously, I am very thankful to everyone.
You know, introverts express themselves through creativity, poems, paintings, articles which you're doing.
Thank you, ma'am.
Have I missed anybody? I just want to acknowledge everybody. Baljinder, congrats. Alpana, congrats.
Nehal.
Kiran, nice seeing you. Geeta Bansal, hi. Who else have?
Nehal Patel. Nehal.
Nehal, hi.
Tilekha
Congratulations.
Joshi.
Jusel Joshi, Heather.
Hello, ma'am.
Hi.
Hello.
Nirmala Joshi, hi.
Rashna madam. Rashna
Srilekha
madam,
Joshi,
thank you
yeah.
for coming.
Rachna, hi.
Yeah.
I don't want to miss any names.
Sushma Ketane, ma'am.
Yeah, Sushma Kirtane, hi. Congratulations. I'm also seeing Neelam, Nimare, Kama Nigam, Aarti, Behra. Nice seeing all of them on the screen.
Swati ma'am, one secret I want to reveal.
Yeah.
That is like you're looking absolutely gorgeous.
Thank you.
Yes, yes. I was about to say
Really,
that.
I love your face, your smile. That's a wonderful thing.
I happen to be, the camera likes me. I'm not that gorgeous. I look better on the camera.
No, you are looking very fresh, very nice,
Thank
actually.
you.
Very great. Yeah.
Good. Now, I think yeah, we have left question answer session. So, Dr. Anamika, you can carry forward because once I saw Swati Bhave madam,
Yeah, I'm so
जादू
sorry.
की छड़ी चल जाती है मुझ पर. I just become speechless and I want to just keep talking and want to hear from her. So now I think you can continue with the question answer session and we have 6 minutes. So if anybody is having any question, you can carry forward. Then we will give vote of thanks by Dipti.
Yeah, one thing I wanted to say, if say, Dr. Smita, you're trying your best to get some policies made by the government, but as till the time the government wakes up and makes some policies, can we as a IAPN as a body, can we at least make some criteria and apply and give some certificates under the banner of IAP to the patients? We make certain, proper, criteria and guidelines, so that like we are offering training institutes at the level of institutes. We are doing it. So similar something sort of a
So,
certificate
Anamika, like I
can
was
be
talking
done
to
for
Dr.
disability.
Can you hear me? Can you hear me? Huh?
Yeah,
So,
yeah.
Dr. Rajshekhar, I was talking to, he's in AIMS, surgeon, cardiac surgeon. So, he's very nice and generous person. He really wants to work on this subject. So, he told me that Dr. Anita Saxena, when she was there, and they were creating some disability certification. I also try to do that. I always write in my this thing. If you see my this thing, so I write the physical activity, the sports, and all those things. I always advise. But whenever you're going for a national sports, suppose. So, if you want to have a kind of ability certificate or your functional capacities are intact, it cannot be accepted in fact. Okay, and similarly, the disabilities also, unless there is a board certified thing, it will not be accepted. I get a lot of later, I am right now in the process to create a parent support group. That is the Child CSD Foundation. So these people were working on the behest of Dr. Krishna Kumar, and it was a child warrior group. So I am trying to, for last 1 year, I am helping them to get registered and make a proper NGO so that they become a voice. And I really wanted the congenital defect as such. There should be separate organization, but they should start working together. So that will be then only you can create a voice, because end of the day congenital heart disease, we can say that there may be many patients, but actually the number, if you look towards the other thing like malnutrition, diarrhea and all those things, then the incidence of CSD is little less. The thing is, now we have to be customized for an individual person. We should not think about in only masses. It's good that we should go for masses, malnutrition and all those things, but then every person has its own life and it should be customized in the best possible way. So that is my whole thing. Because Anamika, because I worked with the this Spandan group, so they became my family to the extent that the child was operated if at the age of 10 years or maybe 6 years or maybe 3 years. Now they are getting married and I am getting invitation. So that's the wonderful family today I have. I have many photographs on my phone where they always send me the invitation and all those things, and it's all good to see them. Many of them are doing very good professional. Like one girl is actually dentist now. So there are many children who do good. One day I was in a meeting for the 3D workshop, and I was giving a lecture there. So I met an anesthetist from GV Pant Hospital. And if you remember, she also spoke in PCSI Mumbai long back, and she herself is a patient of tetralogy of fellow. So these are people who are really working at certain level, all feel that they are very, they are disadvantaged, they are having disadvantage because they don't have any thing telling that their functional abilities are what. So those discrimination, if we want to stop, and that is the definition of disability, you see. जो भी like thalassemia now is included in the disability list, and now we have 21 diseases under the disability list. And that change came because initially it was a fixed disability, like you know, mental retardation, and now they have converted into it that disability can be dynamic. That means like a VSD, if you operate, it becomes normal. And if it is goes become Eisenmenger, that it is definitely a fixed kind of thing. So those things, those changes. And I was talking to Disability Commissioner, the RCI member, Rehabilitation Council of India. So he was saying 10 years, after 10 years, like 2016 we had this act, Disability Act. So he said in 10 years they may think of including certain other diseases and they can revise list. So I am right now aiming at that. I'm talking to MPs. I'm trying to get into touch with the lawyers if somebody can do something. And why this forum and why this topic? I want everybody should talk about this. Like I met the Genesis Foundation owner, the Mr. Sagar. Now, so Mr. Sagar daughter was CSD patient, and then subsequently she is no more. But then they started this program giving financial assistance for the congenital heart disease patient. So I was talking to him, but with lot of effort I got an appointment. So I said, sir, मैं आपसे इसलिए मिल रही हूँ because you are a lawyer, you can do something, a pill or something. He said, no, I am 70 plus, now I don't go to court. So I said, nothing, no problem, sir. Wherever you go, you talk about this. Maybe somebody is there who has sensitive ears and have a capacity to do something. So everybody should at least listen, at least should know that it should be done. And then when कहते हैं ना कि when time comes, then idea will definitely convert it into a real act or real this thing. I'm not right in the quote, but this is something like that. Time comes for every idea. That is something like that. So someday that day will come, and I think it is not far away. I think now Sangita is there, our leader in chief. Dr. Neelam Mohan becomes our president. I was looking towards the Hima Bindu saying, ma'am, I am very impressed by her because she has been such a like it takes lot of courage to fight election once, twice. So I think we all have lionesses over here, and I really think it will be good.
And Dr. Swati Bhabhe, madam, want to say something about cardiopulmonary.
Yeah, I just wanted to say, since you're a cardiologist, Smita,
Yeah.
I was a fitness expert for a karate academy in Bombay for 10 years and has to
Yeah.
certify fitness for sports. Now, as adolescent, Preeti knows that lots of people are being pushed into competitive sports today. And many of them may not be physically fit, but more than that, they may not have the competitive spirit. And for sports psychology, that is a very important thing. And I think as women pediatricians, we should take this up that whenever parents are putting children into competitive sports, they should have a proper assessment, a physical assessment to see that there's no issues, proper nutrition, because these nutrition supplements and sports supplement are causing a lot of damage to the kidney, to the heart, and also androgenic steroids, etc. So we can tell parents that it's good that you're putting children into sports, but please get an evaluation from a pediatrician for the fitness, both mental and physical. I've also written a handbook on sports medicine. So if we can develop a protocol, all women pediatricians can take this up. So children who go into these sports will be fitter. The parents also will be better advised. And sports and fitness need not be competitive. It can be just for recreation. Just because a child plays well tennis doesn't mean he has to go for Wimbledon. So if we can bring that as part of it, Neelam or Preeti or AHA or Sangita with WPF, I think that will be a good thing. As women pediatricians, we being mothers, it will be a very good thing to do.
So the proposed these method, which I actually published the paper, This is all about that assessment of this is subjective criteria, this is objective criteria, because I don't want children who wants to pursue sports and they can pursue sports, they should be denied, and the person who can actually should not go for it, they should not go for it. So that is what I kept on saying to IAP and PCSI, that you need to have a criteria. Unless you have a criteria, how, if insurance people are saying I am not going to give insurance to the health insurance to this person, how can he claim in the court that he should actually get that health insurance? It is all discrimination if he is denied. So those are the things, ma'am. हमें बहुत सारा ना baseline work तो करना ही होगा, and we all need, and we are having a right kind of momentum at this particular
And we
juncture.
feel so sad when 30-year-olds are dropping dead of cardiac problems. Then they're going in for excessive gym and excessive sports. We need to increase this awareness.
So this is absolutely fine, ma'am, because it is now many papers are coming. There is a lot of immunological. I have written a poem also that crosstalk within the body is through the immune system. And when you have an exercise, excess, moderate, and mild. So the moderate exercise like yoga, a regular yoga, Surya Namaskar makes you very healthy. But if you are going for the excessive exercise, you become prone for the cardiac arrest, and they also there are lot of studies they have found the metabolic acidosis in the patient, which is not really good. You are absolutely right, ma'am. Absolutely right.
Thank you.
Okay.
I think if anybody have any questions, they can ask Dr. Smita. Otherwise, we'll wind up and we will go for a vote of thanks.
Make a good question answer session.
Thank you.
Just a point, Dr. Anamika, because you mentioned about adolescent health, so we'll be more than happy to collaborate with you. And that's what we were planning to do with all the chronic medical disorders, and approach to an adolescent, and simple thing like a head psychosocial history to be taken for all adolescents. We love to do that session with for cardiologists, if you would allow us to do so on behalf of the Adolescent Health Academy. That was one thing. And as Dr. Smita was talking about a parent support group, just today I was talking to Dr. Vasant that IAP should have a parent support group for every chronic medical disorder. And he thought that's a little bit too much as of now. But he said that, whatever are the existing support groups, we can definitely put them up on the website. That's what was my suggestion to him, that if it's too much at the moment for every chronic medical disorder like diabetes, epilepsy, even juvenile idiopathic arthritis, if we could have the existing support groups put on the website, that would be a beginning to probably go towards a IAP parent support group, because a lot of these children are now kind of like rightly said by you, surviving into adolescence and young adults and beyond. So that becomes important.
So
Thank you so much.
absolutely, ma'am. Down syndrome and all those, I am working with those societies as an advisor or some capacity, and we do some OPDs and all. So, and I was in really, you are telling me what I really always wanted. This is dream come true. I always think, and I told Dr. Tuteja also that AHS should take up this, because our children are going to be, see, the transition medicine, a thing called as transition medicine is totally absent in the, and you are dealing with that there should be a understanding of something where the people who are dealing with the adults and the children, child medicine, they should interact somewhere. That is what I told this time Dr. Anamika. I don't know if she was there, to the person, Dr. Ramakrishna was giving a very good lecture on the Guj. So I said that the problem is that pediatric cardiologists, they are not allowed to go into the adult as a part of training for 2 months, 3 months in the adult side. They are not going there. So how will they manage the 18 plus? And the similarly, the medicine people should come to pediatrics. Pediatric people should go to this thing. Then only you know what is where, and we can give a proper care to the person. They are no man's land actually. Children, when they go the congenital defect, they cross the 18 years, then they are nowhere, in fact. And this is the truth of the life. Yeah.
I think now the time is over. It is
okay. Thank you
so much. So I think I request Dr. Dipti to just give vote of thanks, and then we will just carry
Yes, ma'am.
forward the whole topic and the support group of parent support group in our next year program. Okay, so over to Dr. Dipti for vote of thanks.
Thank you, ma'am. Thank you, ma'am. Good evening, everyone. On behalf of Women Pediatric Forum, I, Dr. Deepti Singh, would like to express our heartfelt thanks and gratitude to all the esteemed members and to all the WPF members who contributed to make today's session a grand success. As Sahir Ludhianvi has said, हजार वर्क गिरे लाख आंधियां उठे वो फूल खिल के रहेंगे जो खिलने वाले हैं. What a win, Dr. Neelam Mohan ma'am, and our terrific 10. Big congratulations.
Personal message.
Your win will forever inspire us. Thank you so much for gracing the
We
occasion.
have already celebrated Hanamika.
Yes, yes, ma'am.
I'm making a collage of the various comments I received in the 2 weeks. But
Now
ये
we
2
are
weeks के
waiting
बाद
for
एक
you
week
here
collage
in
था.
Udaipur, ma'am. Do come here, ma'am.
Yeah, I remember.
Thank you so much, ma'am.
Absolutely. Anuradha,
Take our next
seriously,
fan
must
Padicon at Udaipur or Jaipur.
Sure, that
Yes,
will be
ma'am.
great. Anuradha ma'am के
I'm
under में
looking
we can
forward.
do very well.
Yes, yes.
Thank you
Yeah,
so
yeah.
much.
उसका नाम जैसे जिसका जादू की
Let me
गुड़िया
have
उसका नाम
something
है
good.
चीज है मस्त मस्त.
I will bring lot of samosas from Delhi.
Wow, that will be great, ma'am. That will be great.
Never today will work. No, that will also work.
On behalf of WPF, I express my gratitude to respected Dr. Preeti Galkali ma'am, Dr. Gupta ma'am, Dr. Ruchira Gupta ma'am, Dr. Shushma Kirtani ma'am, Dr. Srilekha Joshi ma'am, Dr. Rashma Das ma'am, Dr. Kalpana Datta ma'am, Dr. Neha Patel ma'am, Dr. Baljinder Kaur ma'am, and Dr. Deepa Firke for gracing the session. Again, a big congratulations. Our big thanks to our WPF Executive Committee, Dr. Hima Bindu ma'am, our founder and chair of WPF, always inspiring us. Most energetic, Dr. Sangita Lodha ma'am, chairperson WPF, Dr. Elizabeth ma'am, vice chairperson WPF, Dr. Anuradha ma'am, our very own active and inspiring secretary WPF, Dr. Srilekha Joshi ma'am, joint secretary WPF, and Dr. Narmada Ashok, treasurer WPF, for gracing the occasion. A special thanks to Dr. Swati Bhave ma'am for it was such a blessing to have you here. Thank you so much, ma'am. Our heartfelt gratitude and big thanks to our esteemed speaker, Dr. Smita Mishra ma'am, for such beautiful presentation. We feel blessed to have a speaker with such extensive knowledge and such qualification. Thank you so much, ma'am. So very grateful to our moderator, Dr. Anamika Jain, ma'am, for guiding us beautifully throughout the session. Sincere gratitude to the organizing committee as well. Last but not the least, big thanks to all of you for your active participation. Looking forward to many more such enriching educational academic sessions in the future. Thank you so much.
Thank you.
Thank you so much.
Pallavi,